morning, Chicago. I'm Dr. Allison Hourdy, Commissioner at the Chicago Department of Public Health. And thank you for joining us, as always, to get your COVID questions answered. Really pleased to be joined today by the CEO of Chicago Public Schools, Pedro Martinez. We have certainly gotten to know each other over
Yes,
these
we
last
have.
few months. And, you know, I know a lot of you may have questions about the announcement and some of the details coming out of CPS. So as always, you can put questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We will start with some data and look at some slides, and then as always, take your questions live. So maybe just to start us out, in case, you know, not everybody may be entirely aware of some of the announcements from yesterday, you want to just let folks know what's happening?
Sure. So Dr. Hourdy is, in consultation with you and the Department of Health, also after looking at the CDC guidance, the guidance from the state, and we've seen alignment across national, state, and local. We've seen that the risk level is low. And this is the first time since I've been dealing with this pandemic all of us in the last 2 years, that we've been at this level. And we'll show you some metrics that show exactly how low we are, not only at the city, but at the school district level. So yesterday we felt comfortable to be able to announce that we are going to go mask optional. Now, to be clear, we're still strongly encouraging masking, especially in communities where we have high levels of children that are unvaccinated. But really, we just, we felt that, when you see the alignment across all the different health experts, everybody is saying that we are ready to make this move. We were one of the first districts to put in universal masking in our district. Frankly, we're one of the last ones to go down the path of mask optional. But the first thing for us was making sure that the health metrics supported, the health professionals were supporting it. And then, of course, we also want to make sure that we maintain our ability to respond to this pandemic. There's been a lot of legal challenges. We've been very upfront about it. We've been fighting those legal challenges. But one of the things that I need to make sure for our district and for our families and staff, that we always have the ability to respond in a timely manner to this pandemic. And we were concerned about some of the legal challenges that they could take that authority away from us when, frankly, we don't know. It was just 2 months ago we were in a surge. And so we're hopeful that we'll continue to stay safe. And of course, we're going to double down on our vaccination efforts at our neighborhoods that just need that access. And I know, Dr. Hourdy, you have some amazing programs that I keep touting that, they can go to your home. They give you, even cash incentives. And so again, I think this is a time for all of us to join together to continue to get more of our children vaccinated, to keep these conditions to be at low risk.
Yeah, and I will just, chime in on that we are doing well from a vaccination standpoint. This has been such a big conversation around the country, and we have seen nearly all school districts make this decision at this point, including in places that, frankly, I would not feel comfortable making the recommendation, some of the places that are still in surge. But where we look at vaccination rates, among 12 to 17-year-olds in CPS, we're getting close to that national average. I think you're at 64%, if I remember, of your 12 to 17-year-olds have had that first shot, and that compares to about 68% at the national average. So we want to get at least to that national average, and we're going to keep working on it. But the young kids we're doing great on. Those 5 to 11-year-olds, only a third in the U.S. have had that first dose, and
we're 45%.
Almost 50. Getting to almost half of them. So it's good to see the not just the majority, but really the large majority of CPS students at this point have had at least one vaccine, and just about half, 49% of all your age-eligible kids are fully vaccinated, and that sort of 50% mark is kind of the base for us in terms of feeling some more confidence. Now, of course, there are schools that are below that, and those are going to be the ones that we're really, we're not letting up in terms of continuing to work on that. But I do feel confident. So let's take a look at some of the data, and we were talking beforehand just some of the questions that you've already been sending in, to both of us about this decision, and I'll highlight some of that here. So first of all, chi.gov/COVID-, as always, this is where you can see the updated data for the city of Chicago, and boy, do these numbers look good. Look at this, 191 cases per day. That's back down to where we were last July. I wasn't sure we were ever going to see numbers that low again, honestly, because look how much we're testing. 27,000 tests on average in Chicago right now, and that's more than 3 times what we were testing last July. And so if you were at a similar level, you would actually expect to be seeing even more cases. And because we're doing so much testing, we've now done more than 10 million tests in the city of Chicago, and that's formal lab reported tests. Our positivity is down to 0.8% at the city level. We're seeing 16 hospitalizations a day, continuing to fall there. Between 3 and 4 deaths a day, continuing to fall there. Vaccinations still up, under 3,000 a day. I'd love to see that get even higher, because I do worry. But overall, this is really good news. And I thought I would just, first of all, one question that we've been hearing a lot is, but aren't there parts of the city that are still really, really dangerous from a COVID perspective? And I want to say to you very strongly, no. So let's look at this. Like we had Louisa write in and say, there are parts of the city that are 10% positivity. That is just not true right now. So if you click right over, on the dashboard here, you go to cases by zip. Right here, you can click on cases, tests, deaths, positivity. You can look by rates, which corrects for population. You can look by numbers, but I defaulted here to positivity. And what you see here, always, this will update. This updates, this particular map updates once a week, so this is the most recent data. And the darker always shading means the areas that are worst. But worst here, if we hover over this, out in 60656, Jefferson Park, Norwood Park, O'Hare, which is actually an area where we've seen a little bit of lagging vaccination, worst in the city right now in positivity, 2.5%.
Wow.
2.5%, worst in the city. I'm telling you, that is a beautiful place for the city to be. And part of the reason the positivity is relatively high there is that the testing is relatively low there, right? So only 1,280 tests in that setting. But you look at some of these areas that where the vax rates are lowest. I mean, look here, 60644, 0.5% positivity, 60624, 0.3%, 60623, 0.6%. I mean, obviously these are areas that have been so hard hit, and they're doing really well. So you can look at this every day. The next worst right here, are at 2%, but worst in the city, 2.5%. And no matter what metric you're looking at, we are in good control. We have seen the less vaccinated zips get hit much harder in this last surge with cases, with hospitalizations, and with deaths, which is why we're not done vaccinating. But we are in a good place, and that's true no matter where people live and no matter where they go to school in the city. I also just wanted to bring up, and you can explore some more of that if you like. I wanted to just bring up a few slides here just to highlight some of the ongoing progress, again, with a little bit of an eye toward the questions we've been getting around schools. So first of all, on the travel advisory, this is where finally we're starting to see COVID really wane in a lot of the country. The states in yellow here are off the travel advisory, and that just means we're seeing low daily case counts, less than 15 daily cases per 100,000. It's the equivalent of Chicago seeing less than 400 cases a day. So when we see states go back to yellow here, they're really doing well. And look at the Midwest, we're making good progress. Appalachia is still having some trouble, but overall, good progress, and we expect next week this to continue to improve. I did want to highlight that, I've been getting a lot of questions as we're coming up on the 2-year anniversary of when some of the big shutdowns happened and people started to pay attention to COVID. How well do I think we've done as a country? How well do we think we've done as a city? And I just wanted to highlight that I am sad with how we've done in a lot of ways as a country, in particular from COVID. And that is not because I don't think there's been a robust response. It is not political in any way. It's not about who is the president. Like, that is none of what we are talking about here. You know me, I look at outcomes. And when I look at outcomes here, this is out of the Times, but it's based on available data. The share of Americans who have been killed by COVID at this point is at least 63% higher than in any other large, wealthy nation. And so on the left here, this is showing you cumulative deaths throughout the pandemic. And this is corrected for population. And you can see that we're leading there. Not something you want to be leading in. But more concerning to me is on the right side here. And this is also what we saw in Chicago, frankly, where in the Omicron wave, look at the US just standing out as so many more deaths compared to these other places. all of these places have had good vaccine availability. The big difference is we haven't had vaccine uptake like these countries have. And so similar in Chicago, so many of the deaths in this last Omicron wave, not all of them, but a lot of them are more preventable with vaccination. And so I really, you know, I worry about how, as a country, we continue to make decisions that have led to these kinds of outcomes. But I want to reassure you that the risk right now in Chicago is low, even while we look at this. Here's sort of the obvious answer about what's contributing to this, where you look at the share of the population fully vaccinated. On the left here, the US in black, you know, we started out first and highest because we had the most vaccine available, and, you know, a lot of the best vaccines in the world were created here. But then we really saw this flatten out. And we've seen all of these other countries come well past us in terms of vaccination rates. And then when we look at boosters, the same thing. We're lagging really so much there. And I worry that looking ahead, you know, I'm very much hoping we're not going to see another surge, but the US is not in a great place compared to the rest of the world. You know, there's 100 countries or something that are more vaccinated than we are. And there are parts of the US that are more vaccinated than Chicago, and that worries me. You know, again, not from any political standpoint, but from the point of I don't want to see people die unnecessarily. And so even while we're celebrating the progress, I do just want to highlight that I remain concerned when, you know, related to graphs like this. Here is what's happening with variant surveillance. A lot of you are writing in asking about BA2. So things are looking good here. Yes, we are seeing, so first of all, just a reminder, each of these vertical lines is a week. And so if you look back on the left there, that's from November, everything was orange, deltas, you know. And as the weeks have moved ahead, we saw this purple Omicron come in so quickly. Look at how fast, just in the matter of weeks, that Omicron B.1.1 came in and displaced Delta. This was our surge right here in Chicago. And at this point, everything we're detecting is Omicron. We're not even picking up any more Delta. Yes, we are seeing this substrain a little bit, this BA.2, that's the light purple here, and it's increasing about 5.9%. But the good news is, while we've been seeing this subvariant increase, our cases have continued to drop. And we're watching it, of course we're watching it, but I remain very confident about where we are right now as a region, as a city, and as a state. The risk matrix continues to look beautiful. This is, of course, the one we've been following all along. Everything in lower or low transmission state here and continuing to fall. So I wasn't sure we were going to get cases diagnosed per day back down there, but we have, with that concurrent drop in positivity, and our hospital beds were down to just 157 hospital beds occupied by COVID patients outside the ICU, another 42 in the ICU, and a lot of those folks, not all, but a lot of those folks, you know, are recovering, and every day this is looking better. As CEO Martinez said, there's also been this big national conversation about COVID-19 risk levels. And, you know, we all along here have been looking at healthcare, and it's been part of our metrics. But the CDC has moved to also think about what does it mean to classify a community as low, medium, or high risk. In particular, what does the impact look like on the healthcare system? And so low risk communities are where we're seeing low levels of severe illness, limited impact on the healthcare system, not seeing surges. Medium, we get a little concerned. We're seeing some impact on the healthcare system, more people with severe illness. And high means high potential for healthcare system strain, high levels of severe illness. And as of February 24th, this is what the US looked like. You can see here in Chicago and really across Northern Illinois, we were in low risk, which I knew we would be because we've been doing well here. But you can see only, fewer than a quarter of the counties were in that low risk, and that wasn't true for the whole state. As we've moved ahead, see that just in 1 week, this is how much better the country's doing. And so as of March 3, just about all of Illinois, most of it is in green, some of it is in yellow. There's still a couple of downstate counties in orange, and CDC does recommend that everyone should wear a mask indoors when we are in orange at a minimum. And I think, people have also been writing in questions about sort of what comes next, when might we go back, et cetera. We start to see trouble here, we get into yellow, especially in less vaccinated settings like schools. Yeah, we might might be putting masks back on. I'm not at all saying it won't be a thing. Hoping it won't, very much hoping that we continue this excellent place where we are now. But when we are doing well, and we are doing well by every metric, I do think it is appropriate. The risk is low and it is appropriate. So,
Yeah, and Dr. Wadi, just going back to just even when you look at this map,
yeah.
because I get asked the question a lot of like, aren't you responding kind of quickly? Because we had just had a board meeting where we ratified our previous decisions about
Yes.
masking because we were very proud of all of our safety procedures. And I think, for our community, that it just has changed so fast.
It has. It
in
has.
a positive
yes.
way.
And you see this here, like that's, 1 week.
So it's, one of the things that, I think we always have to be ready to respond to where the pandemic is going. In general, we've been used to responding to surges.
Right.
We saw that with Omicron, and then this is the first time in 2 years where we're responding really, frankly, to a much lower risk scenario, which might be hard for our families. Can you talk about using as you look at your own risk matrix, when would you advise us to go back to masking? What is it that you would see that you would tell us we're now at a higher risk level?
Yeah, so I think, behind the scenes, we're obviously, in addition to the main hospital metrics, and we've been following all along, we follow things like emergency department visits. We obviously follow variants. There's a lot of things we're looking at behind the scenes, and our epidemiologists are very good at seeing changes in that, early changes in that. I can tell you that if we got back even to yellow in settings that were less vaccinated, like schools, we would be recommending putting the mask back on, at least for people who are unvaccinated. And I'll tell you, we get back to an orange level, we're going to be putting masks back on because we don't want to be running that risk. We got to make sure that we're not unnecessarily, when the risk is high, the risk is high, and masks are a piece of this. But I believe so strongly that when the risk is low, especially where vaccination rates are good, it's important to be lifting this. So why don't you go ahead and just do a few slides, and then we'll get to some of your questions.
So this is just some CPS data. So first of all, you can see our cases. So you just heard the city's cases. This is our case for the entire week. So not just for the day. And we tend to follow the city. So when the cases are low in the city, we see it across our district. You can see 141 student cases. This is the lowest we've had since the school year started. As well as very low cases for staff.
And for the whole week, 141 students, no matter, and that's kids out of, whether they're getting infected, out is like, doesn't matter.
It doesn't matter because these are positive cases that come in. I mean, they always come in from the community.
Yes.
But this is the lowest numbers we've seen reported since the school year started. And the good news is we're also seeing less both students and staff working from home.
Yep.
We're now doing the 5-day, working from home or, studying from home, which is great because we're bringing them back sooner. But it wasn't that long ago, Dr. Awadi, and 2 months ago, we were at 20,000 of our students were studying from home.
Yeah.
And much higher numbers for staff. This is the lowest, again, that we have seen, just in the last, really since we've seen any of these surges. And what's great is, we talked about the city's positivity rate. Ours is at 0.11%.
It's amazing.
Every week it gets lower, and this is district-wide. This is, and I think it's very important for you to show the neighbors, we're not seeing across schools any big differences in cases.
Yeah.
So this is across the entire city, across all of our schools. So this also gives us much more confidence. I think the community needs to know that our staff are in constant collaboration with your team. We're constantly talking. So none of these decisions are made without consultation with CDPH. We're always looking at cases, potential, if there's any risk of outbreaks at schools. But again, we have not seen this low rate.
And can I just highlight here, the folks who watch this, we talk a lot about how testing and cases and positivity fit together.
Yeah.
So look at that blue line there. That's how many, these are the screening tests that are happening in CPS. So we would expect, that the positivity rate would be lower than the city, where the city you've got folks coming in, who are sick and all the rest of it. But look at how high that blue line has gotten.
Over 60,000 tests per week.
Per week. That's an amazing number of tests. And so as those number of tests has gone up, in red there are the number of positive tests within that. And you see that even sort of in the worst of the surge, that was relatively low compared to the number of screening tests. And again, it just reflects that there are so many other systems. There are these other mitigations in place. And we look at what these positivities look like across, by the way, we look at like what New York's is and what LA's is and what some of the other districts are. And we're doing so fantastically well
Yes.
here. And I'm really, I want to really
Thank you.
give you and CPS props, and everybody who's
Yes.
been working to
Yes.
increase vaccination rates, increase that testing access, really fighting to make sure that our schools
Yeah.
are safe. And that includes, the folks who and the teachers who said, we want to make sure there's masks, we want to make
Yeah.
sure these pieces are here. We're all on the same page of wanting to make sure
Yeah.
that we can educate kids. That's the top line, and that we can do that in person. Education is critical, but boy, this is just, I love seeing this.
Well, and Dr. Awadi, we have more testing capability now than ever before.
Yep.
We were trying to get up to 40,000 before the Thanksgiving break. We're now consistently over 60,000. Every single school, high percentage of students being represented, especially our unvaccinated students. And we have now Binax home tests
Yep.
that we're going to be able to use for families. And so now we have more capabilities to identify kids than ever before, and even with that 0.11%.
Perfect. All right, so let's go ahead and get into your questions here. Switch here. CPS parent, that's a good one to start with on Twitter, says, how do you pick which CPS schools get vaccination events? Thank you for doing them.
No, absolutely. So we first we look at schools that have low percentages of students that are vaccinated. We're doing several thousand outreach calls out to those families, inviting them and registering them for events. So we're doing that, and we have several hundred families every week that are taking advantage of it. We also have our 16 clinics that are open. I will tell you, we want to do more. We want to do more, so we're actually reaching out to community partners as well, who may have a relationship with the community, so that there's trusted medical professionals. So that's something we want to do more of. But we start with our schools that have the lowest vaccination rates.
Yeah, and I think we've thought a lot about how together to reach not just students but families,
Yes.
because I think very often the ability to have these conversations sort of in the school community, you're educators by
Yes,
definition.
that's
And
right.
so what does it mean where everybody's thinking about creating sort of a safe and nurturing and educational environment, and how do you have those conversations and sort of build that trust
Yes.
as a school community, I think is, there still is a lot of opportunity there. And so, we've really doubled down in terms of, at CDPH, making sure, for example, that where there are some of those financial incentives, making sure those are available, through CPS events. We know that can be important, especially if there are families that, may have lower incomes. They're taking time out of whatever they're doing to
Yep.
go and get this done, for both students and parents and grandparents and aunts and uncles and neighbors, because what we have seen so clearly is that it is risk in the community that drives what we
That's
see in the
exactly right.
schools. It's not the ongoing spread
It-
in the schools.
Yeah, everything always, we see the cases first in the community, and they come right into the schools
Yeah,
afterwards.
and you guys have, you've done like more than 700, I think, of these vaccination events. A lot of CPS.
We have them every day.
Yeah.
And the great thing is we have mobile events, so we go to the schools once we have families registered.
Yep. All right, we've got a lot of mask questions. Let's start with, Sean Melnick on Facebook. Here's a good basic one. What's going on with removing the CPS
Yeah.
mask mandate? Exactly when does it start, and how are the schools taking this action?
No, it's a great question. So it's effective on the 14th, and the reason we decided to do it on the 14th was we actually have developed materials for our teachers to be able to talk to children, because we still are encouraging masking, and so we want to make sure that when children have questions about why some children may not have a mask on, that we can facilitate those conversations for children. We want to be inclusive of all of our children, and so for us, we're doing that all this week. We're answering questions that families may have. We're working very closely with the Department of Health, because there's still very strong procedures in case there are cases in school. So we're doing all of that this week. We'll continue to provide communication all in, as through the rest of the school year as well.
Yeah, and maybe I'll double down. Lee Mabry White on Facebook says, how will CPS support children, or I would add staff, who continue to wear a mask? There have been reports of children bullying others, ripping masks off.
Yeah, so I mean, that's the reason why we decided, and we wanted this week to really provide materials to teachers to talk to students about the fact that it's perfectly fine for children to wear masks, perfectly fine for some children not to choose to wear masks. It really is about your comfort level, and we want to be inclusive. We also are making sure that families know all the risks. For example, if you're unvaccinated and you're exposed to somebody who's positive, you'll be required to wear a mask for 10 days, as required by the CDC and CDPH and the State Department of Health as well. So these are it's confusing for families, so we want to make sure with our teachers, our nurses, our counselors, we're providing quite a bit of information, and we're going to be holding everybody's hand, throughout this process.
Vicky Trinidad on Facebook to me is asking, can I please explain how and why CPS is lifting the mask mandates by making it mask optional, et cetera? And I want to double down a little bit on what you said. Because I see some other people saying, are masks going to be gone? Are they ever coming back? And I want to be clear, masks are not gone. Masks are not gone.
Right.
First of all, CPS, just like our other schools, have worked hard to have masks for kids and adults, and not just masks, but KN95 masks, right?
Yes.
They're the best masks available for students out there in
every school.
Every school available
We'll be there
there
till the end of the year.
in place. And those are masks that can give a little bit of a higher level of protection where somebody is wanting to wear themselves. But even setting that aside, there are absolutely settings where children and adults will be required to wear masks. So maybe we'll just talk through some of them, because I see some questions.
Yeah.
So first of all, isolation and quarantine are not going anywhere. So I'm thrilled with how few kids are needing to quarantine right now. But remember, when we were in a surge, there was a lot of quarantine happening, and there needed to be, and that would be in a surge. Those are not going anywhere.
That's right.
If your child is not vaccinated and they are exposed to somebody with COVID in school, they will have to quarantine, for that full period. And then for staff, for everybody actually, where we've been able to limit some of this time frame, remember, 5 days of isolation or quarantine, you gotta stay home if you've been diagnosed with COVID. As long as you're feeling better, your kids can go back to school, your staff can come back to work, you could go out and about days 6 through 10. The masks you still have to wear at that point.
Right.
So
That's
this is where there's going to continue to need to be a lot of education for folks.
Yes.
And we really have tried as a city, I don't know if you've seen some of the new signage, it's available to businesses, et cetera. We've really tried to emphasize this be kind messaging, that this is a difficult time for folks. We're excited to be at the point that we are, but it's hard for people.
Yes.
And I want to just let you know that our goal is to absolutely make sure that people who continue wearing masks at this point feel supported in that, comfortable in that. Anybody who's got any potential symptom of COVID, you better be wearing a mask, right? Anybody who's got symptoms, we need you taking that test. Like, those things are not going away. But I think in terms of lifting the mandate, it's because the risk is lower, and really low even by every metric. Old CDC, new CDC, old CDPH, new CDPH, comparing to districts across the country. And we know that when we're doing well as a city, we're doing well in our schools.
And we're one of the last districts.
Yeah.
I mean, we're not one of the first districts. We're always going to be more conservative because we want to make sure that safety is always our priority.
Yep. And I know, you waited to get to the point where every one of those CDPH metrics was at that lower point.
Yes.
And we were certainly supportive of that, where we know the CPS is not as vaccinated as the city at large.
That's right.
So, okay. Mary Rodriguez on Facebook. Mr. Martinez, will teachers in individual schools be able to develop mask policies per school or classroom? Sounds like if there's another variant surge, the district could respond again.
So first of all, the policy would be at the district level, but to be clear, if we see risk levels go up, and this is in consultation with CDPH, and we'll also watch the CDC, if our community goes into a higher risk, we will reinstate masking. And so we're not going to be mask optional forever. Now, I would love it if
Unless COVID is,
if more people-
treats us beautifully, but yeah.
If we get more people vaccinated, we stay at a low risk. That's what we all would like. But we are, and this is very important for when we made this decision, we didn't want a court to take away that authority from us because that was the risk that we had. But we will go back. It will always be in consultation with CDPH as well as watching CDC and the state, and also the Department of Health from the state.
Okay. Question here. Vaccines are often required for school attendance. Do we think there could be a vaccine mandate for school attendance? It seems like nationally and politically, lawmakers may not make that happen. Let me just start on that, and then if you want to chime in.
Yeah.
So, as you know, and as Mary wrote here, we have a lot of vaccines that are required for school attendance. At this point, the COVID vaccines remained under what's called EUA, the Emergency Use Authorization, for children. They absolutely will come on. They will gain the full status just as they have for the adults and the oldest kids. But while they remain under that emergency use authorization, I do not see a world where that would be a requirement. But there have been big conversations about this, and I think some of this depends on how we're doing as a country, frankly. I don't think this is something that's going to be coming up, just from my standpoint, in these next few months as we finish out this school year. But as we see what's coming next, as we see what happens with variants over the summer, as we're sort of looking ahead more toward fall, I expect that this will be a conversation. If we do really well here, if we don't have new variants emerge, if things are looking solid, it's not something that I think is a foregone conclusion that we would be doing this, but we also know it's been something really important to protect folks. But we wouldn't do it, from my standpoint, while the vaccines for those youngest kids remained under emergency use authorization. Anything you want to add?
No, just we will always follow what the medical experts are saying, including, of course, our medical expert here, Dr. Awadi. So for us, we'll continue to watch the guidance. And right now, for 5 to 11, it's still under emergency use. We're still waiting for vaccines to be approved even on emergency use for under 5. So I think we just have to be patient. But again, we'll just continue to watch the guidance from your office, Dr. Awadi, as well as the CDC.
Okay, a couple of questions here about the CTU. So maybe I'll let you take those, but let me just read a couple of them. Renee Freisinger on Facebook said, "How is this going to work with CTU? This is a violation of the MOA. Our kids can't handle another strike, work stoppage, whatever. Adults can't either. How is this going to work? Why not leave well enough alone without any more upset for the rest of the year?" And then I've got Sean Melnick from Facebook saying, "Do you foresee CTU action? There was an agreement in place till the end of the year. Do you think there'll be a strike?" Just speak to that relationship and that conversation.
Absolutely. So I have been speaking to CTU leadership over the last couple of weeks about the potential of us going mask optional. In general, we were watching where the nation was going. We were watching where other large districts are going. Every large district now is going mask optional. We're going to continue to work with CTU. They're a valuable stakeholder for us, a valuable partner. I don't anticipate, more serious consequences in terms of work stoppages, but we will continue to work together because we have it in both our best interest to keep our community safe. I feel, I'm cautiously optimistic that if conditions stay low, at low risk, this could be the first time in 2 years that we could, end the year with having this amazing option. But we've also both agreed that we need to partner in getting more of our families vaccinated. So I feel there's more agreement than disagreement.
Okay, good. Yeah, and I would just say that I think, we've seen CTU, we've seen teachers really stand up for safety in schools, and I love that, right? And I think recognizing, the really high rate of vaccination, certainly among staff, is part of what makes me feel so much more comfortable knowing that adults are more likely to have those severe outcomes, and the ways in which vaccine has been taken up there means that I don't have the concerns that a lot of my colleagues do around the country where their workforces are so much less vaccinated. Those are the folks that you really worry the most about getting seriously ill, ending up in the hospital. And so, I think that I hope that all parties sort of recognize that everybody's on the same page with wanting to keep schools safe, of course. And everybody's on the same page with wanting to make sure that the focus stays on education.
That's right.
And making sure that teachers and everybody can, do that amazing job. I'm a little worried, sort of as a society. One of the biggest predictors of whether folks get vaccinated, for example, is their level of trust. It's their level of trust in the medical system. It's their level of trust in the government.
Yeah.
And we have seen trust drop a lot during COVID. We've seen trust drop among doctors. We've even seen trust drop for nurses, like by quite a lot, and they're the most trusted profession. We've also seen trust of teachers drop a lot, and that just hurts me, And I think it's so critical that we, together are sort of rebuilding the trust that society has in our workforces, in the people who educate our kids, and the people who, care for us when we're ill. What does that mean? That means working, I hope together to make sure that we absolutely are keeping things safe. And we've seen how critical it is. I mean, I think there's been a lot of appreciation for the work that teachers in particular do during this shutdown. So, I'm really hopeful that things, from a COVID perspective are going to stay here. But we get back into I think certainly at the city level, we start seeing it get back up to that medium risk level in less vaccinated settings like schools. That's where we'd be
and I would say, Dr. Arwady, that's the biggest concern I've heard from both, our union leadership as well as, some of our staff. And my assurance to them has always been, we will follow the science. Right now, risk is low. If that changes, we will respond immediately. The only other thing I would add, when we saw these things happening in the courts as well, because I really want our community to understand this, it was a very, very high level of risk that our authority could be taken away. And it wasn't just for masking, it's for every safety procedure that we follow based on CDC, based on the state and CDPH guidelines. That's too big of a risk for us, because then that would create even more anxiety for both our staff and our parents. So, but we would never have done it if conditions weren't at a low risk. And so that is always going to be our first thing that we look at. And as we look at the entire city, across different neighborhoods, across different schools, with a 0.11% positivity rate, with more testing than ever, it's the first time in 2 years that we felt comfortable to be able to do something like this.
All right. I'm going to take question here. Adams Irene, this one's for me, on Facebook says, I don't want my soon-to-be 5-year-old to have his DNA altered later in life and have issues because the vaccine doesn't have 10-year data. Thank you for that question and for raising that concern. So let me address both of those. So first of all, let me be really clear. None of the COVID vaccines alter DNA in any way. The Pfizer vaccine, which is the one approved for children at this point, is what's called an mRNA vaccine, a messenger RNA vaccine. Literally what it does is it brings a message to your cells, into your muscle cells here, and it teaches those cells how to produce the antibodies, the protection against COVID. But that message never even gets into the nucleus of the cell. The nucleus of the cell is where the DNA lives. It does not alter DNA. It does not interact with DNA. There is not DNA in the vaccine. There is absolutely zero risk of altering DNA. So I just wanted to clarify that. But to your larger question about, the vaccine not having 10 years of data, it's true. This particular vaccine does not have 10 years of data. But let me talk to you about why I still feel, why all my nieces and nephews and all the kids I love in my life, I had sign up for it right away, is because always when we have ever develop vaccines. We have a very robust vaccine safety, very robust. We're known for it sort of worldwide here in the US. And whenever we've seen problems arise with vaccines, it's always been literally in the first few weeks. So we pay a lot of attention, and I really want to thank, the adults and the children who volunteered for the trials, and lots of safety work done around this. There's the safety standards for vaccines they're really high, much higher than they are for medications, because by definition, you're giving them to healthy people. So you have to have such high safety standards. But we've not seen a vaccine in history show up with problems years later. It's just not how vaccines work. The vaccine itself doesn't even last. Like the actual vaccine in your body is gone within hours to just a few days. Wow. So it's not there anymore. It just teaches your own cell how to fight off COVID, and then it's gone.
It's amazing.
And so there's no 10-year data, but there's no reason, honestly, to be concerned that we would see problems cropping up 10 years from now, because that's just not how vaccines traditionally work. All it's doing is teaching your child's immune system or your immune system how to fight off this virus without you having to have the side effects and the risk of getting sick from the virus. So thanks for raising that. And there's a lot more information if you're interested about that on both the CDPH and the CDC website, and I would encourage you to talk to your son's pediatrician about it too if you have questions. Okay. So Miriam from Twitter. How will CPS handle students who require medical accommodations via a 504 or an IEP to access school? They're asking about masking students with disabilities, et cetera.
Yeah, so absolutely. So first of all, if the goal is to have children in for in-person instruction, we'll always start with strongly encouraging masking. And that's why we are providing so much more information to families and really working with our teachers and counselors and nurses. We do have our virtual school, so we do prioritize children with medical conditions, and we also, I've shared with our CTU leadership that I'm also very committed to working with staff that have medical conditions as well. So we will find ways for them to, whether it's teaching remote, whether it's children learning remote, or other options we'll find.
All right, David Gold on Twitter. Isn't there a risk that a new variant will crop up and heavily infect schools with low mask usage before CPS has the ability to act and reissue a mask mandate? I'm glad you're worried about variants. That is certainly the long-term thing that it's the big question mark here. I want you to be reassured that CPS doesn't look for variants. CDPH does. But the way that we do this is we collect samples from across the city of Chicago. Whenever people are testing positive for COVID, we are collecting those in a random way, and they come to our, what we call the Regional Innovative Public Health Laboratory. Rush University happens to be our partner there, and they are testing samples from across this city every single day, and we are looking to see what is the variant. So that data that I showed you about, what's happening right now with Omicron and BA1 and BA2, that includes City of Chicago data that is collected sort of via CDPH. The state, Illinois Department of Public Health does this across the state. Some of our other academic partners, Northwestern and others, do additional testing, and every single time in the whole country, actually in the whole world, that a genetic fingerprint gets taken of COVID, meaning we're looking for a variant, that gets uploaded into one database that everybody can see. It does not have there's no privacy concerns. It doesn't say this is, Joe Smith from Chicago, but it's got information that we can see. It's not about the person that has it. It's not the person's genetic makeup. It's the virus's genetic makeup. And so, I am very confident that we will detect time after time here where there have been variants. We've detected them early here in Chicago. I think all of them we've detected first where they have been, we have travelers here. We have a good system in place. And if we need to make decisions, we will see this at the city level. There's not a higher risk in schools because schools have so many other things in place. All of the major investments. I mean, how much have you guys? $100 million?
Over $100 million between PP&E and our filtration systems. And Dr. White, we've always said this. and I've seen this firsthand, cases always start at the community level, and then we see them in the schools.
Yeah.
So it's always, the schools always follow and lag.
Yep.
And we are in constant communication with Dr. Awadi and her staff on every case that happens in a school. And so that's happening on a regular basis. So if we see some risk, we will immediately, talk to the Department of Health, and we will immediately respond. And that's what we're really trying to do, is to to be able to respond in a timely manner, because we know with this pandemic is you can't predict where it's going to go. And if something's happening in a particular neighborhood or school, we will respond immediately.
Yeah, and let me just, folks may not realize, but CPS, you actually are planning to maintain a number of the extra things, that actually is going far above what CDC recommends. So just to give you a sense of this, CDC recommends that universal testing if you're at medium risk. We are keeping it here, right?
And more than ever.
And more than ever, and continue to grow it and seeing that growing up. I actually, to your point, we would see if there were trouble, we would see it in CPS before we saw it anywhere else, because that's where you've got this amazing testing across the entire city, right?
Yes.
And our ability to sort of think about what that looks like. It's not that the risk is higher, the risk is lower in schools, but our systems are also the best. Whether you're talking about testing, whether you're talking about ventilation, whether you're talking about all the ways that we're able to adapt, there is no safer place for kids to be than in school. Where we see the risk, really still, the highest risk still is in home transmission. That's right. And then the other thing is, wherever we are seeing cases or any potential transmission, right away the CPS team is in contact with CDPH. And if we see a sign of concern there, we might say, we need everybody in this classroom to be masked for a few days while we figure out what's going on, or in this setting. It's not that we're saying we will never use this tool again, but we don't need it universally. But we'll use it if and when we see situations. And then if we start to see a higher risk or new variants of concern, et cetera, of course we'll return to it. But right now, we're in a good place.
Yeah.
All right. So let's see. I'm trying to make sure we can get the risk here. So here's sort of an opposite opinion. Liz from Twitter says, I'm glad to hear CPS is joining a lot of other school districts and moving to a mask optional policy. How would CPS address teachers who try to coerce or force students to keep masking?
Yeah, so again, we're providing materials directly to teachers, and just really talking about being inclusive. It's not even really about pro or against masking. It's just being inclusive of children and making their choices. One of the questions that we got quite a bit was, why didn't we phase in schools? We have some schools that have very high vaccination rates and others very low. And this was a conversation Dr. Awadi and I had, and we talked quite a bit internally with my staff and our health department. And I'll tell you, for us, one of the things we said is we need to trust parents, and we need to, be able to respect that they have the ability to choose. I expect that in many of my schools that have low vaccination rates, the vast majority of children are going to continue to wear their masks. And we want to make sure that children feel comfortable with that they don't feel like there's something wrong with that. And so that's the information we're providing teachers. But it really is about just being inclusive, being respectful of each other. And of course, we want to continue also to do a significant amount of outreach for those communities that have low vaccination rates, because we have the resources. We're very, very blessed to have Dr. Awadi and the Department of Health that they can actually go to your home. They actually provide financial incentives. So we want to even strengthen that even more.
All right, let me hit a couple of these a little bit quickly. Linda Might on Facebook says, you never ever talk about therapeutics ever. So Linda, maybe you haven't been on with us these last few times. I'm glad you're raising therapeutics. We are spending more time than ever thinking and talking about therapeutics, but today we're really focused more on kids with CEO Martinez here. But for adults, yes, we've been saying, I literally have it in every slide set that I present, and we've been lifting it up. In addition to vaccines, the fact that we now have both IV and oral medications available, particularly for adults, that are higher risk for bad COVID outcomes that can help keep people out of the hospital. We've already built an amazing network for that here in Chicago. It's something we're really focused on. And we want folks, if they get diagnosed with COVID, calling their doctor. And that, that would also include kids, especially if there's underlying conditions. But the focus of today is really more on the kids. But thank you for raising it, because I always like to talk about their, therapeutics. And if you look back over the last, I don't think there has been a Facebook we've done in the last, probably 8 weeks that we haven't talked about it. So I would look back if you want to hear some more. Okay, let me hit, I saw one here I saw one, where did it go? Sorry. Somebody was asking about flu. Oh, here it is. Connor Nichols on Facebook says, the reason there are so many cases is because the tests can't tell the difference between COVID and the flu. So Connor, that's not true. So let me just talk a little bit briefly, just so you understand, and I'd love to, if you can send me where you're reading that or hearing that, would like to hear about that. COVID and flu are completely different viruses. You cannot tell whether somebody has COVID or the flu without a test, but the tests that you do will only tell you if somebody has COVID or if somebody has flu. The scientists are working, and they're actually, if you were to get hospitalized, there are increasingly some swabs available that you can run, like in the emergency department setting, and it'll actually check that swab for COVID and the influenza virus and RSV and some of these other ones. And I think we probably will see more more testing options, for COVID and the flu. But no, the cases that we count of COVID are COVID. There is not cross-reactivity. There are not people who have the flu and you think they're testing positive for COVID. It is COVID, and thank you for raising that. Because the test definitely can tell the difference. And I think it's important to remind people that you do need to get a test to know whether something is COVID, the flu, a cold, etc. And we want people to continue testing. And that's part of the, more accessibility to these at-home tests, including sort of through CPS, is really important. So if your child or an adult, you've got symptoms. I was getting over a cold, a cough last week. I was testing myself every day. I didn't want to run the risk of sort of bringing in COVID. And that's really important, but thanks for raising that.
And we have, Dr. Wadi, we have home tests that we have available for anybody who wants them at the school level. So please, if you need them because you're worried, we'd be happy to provide you those home tests. And of course, you can get them directly as well.
Yep. Okay. I'm trying to make sure we can get through kind of all of the main topics here. I'm going to take Roberto L. Tiburon on Facebook. It says, Dr. Arwady, the mayor says if I take the vaccine, it will prevent me from getting COVID. Is that true? So the vaccine is the most important thing you can do to help protect you from getting COVID. It is not 100%, so we definitely see people who have been vaccinated. We've seen people get what we call breakthrough infections, and we saw more of that during Omicron especially. So it is not 100%. Actually, no vaccine is 100%. But what's especially important is that the vaccine is the most important thing that helps keep you from getting seriously ill. And so for me in this last Omicron surge, it really hurt my heart to see it hit Chicago so hard, because so many of the folks who were getting hospitalized and dying from COVID were folks who hadn't been vaccinated yet. Not all of them. I want to be clear about that. There are folks, especially with underlying conditions, et cetera, who can get really sick and hospitalized and even die. But the great majority are folks who had not chosen to be vaccinated. And so when the mayor says to take the vaccine, she's not a doctor, so, but if you're the one she's listening to, we've worked a lot together to talk about what is the vaccine for, what is it not for. It does decrease your risk, though, of getting COVID. And just to sort of put a little statistic on there for you, still more than 90% of the people who have been fully vaccinated for COVID in Chicago have not had a breakthrough COVID infection. I still haven't. And more than 99% of the people who have been vaccinated fully against COVID have not been hospitalized for COVID, and way more than 99.9, I think it's even 99.99% of the folks who have been vaccinated against COVID here in Chicago have not died from COVID. And so it is the most important thing that you can do, and it does decrease the risk, even of infection, even with breakthrough. So I hope that helps, and I appreciate the question. Steve Cal, I'll just take a couple of these science ones real quick. If I get a booster every month, will I be protected year-round? So Steve, there is not a need to get a booster every month. The good news is that the booster, meaning that third dose for people who got a first and a second dose of Pfizer, or first and second dose of Moderna, or a second dose, I would get either Pfizer or Moderna if you got a J&J back in the day. Please get that booster, but you do not and should not take a booster every month. We've shared on here that the data has been very reassuring, actually, around how protective, when you get that third booster, the vaccines have been, even with the new variants. It's not just about antibody levels, it's about the rest of your immune system, your B cells, your T cells. The best protection out there are people who have been fully vaccinated, they're up to date, they had their booster, and they've recovered from COVID. That combination is the best protection out there. But please don't go trying to get COVID if you haven't had it. There's still a lot we're learning, about long-term effects, et cetera. But there is no indication for getting a fourth vaccine even, and definitely not one. You do not need to be getting a booster every month. We will let you know if there is a new variant, if there is another recommendation in the future. But please try to rest assured in your vaccines. If you've been vaccinated and you've been boosted, you have the best protection, and the risk is low right now in Chicago. So it is the time to be able to be reclaiming a lot of that. All right, we're just about at time. There were a few questions that I didn't get to. Vicky Trinidad on Facebook saying, I've noticed when more sound data is gathered, there are some long-term effects from COVID that have occurred. Can those become permanent? Alexandria Deanne is asking about lingering cough, long COVID. What do we need to know about this? We'll talk a little bit more about this at our next Facebook Live. There is still a lot we are learning, for sure, about long COVID, about MIS-C, which is that inflammatory version that the kids can get. The good news is, again, vaccine is the most important thing that helps protect you. And we've been on some really good conversations with CDC about how are we setting up nationally the systems to follow these longer effects, right, from COVID, which have been really real for a lot of people. So we'll talk a little bit more about that the next time that we're back. But I think we are just about at time here. Is there anything else, CEO Martinez from the Chicago Public Schools, anything else you'd like to say just to the CPS community?
Well, first, Dr. Awadi, thank you, and the partnership we have, it's invaluable, and I just want our community to know we will always lead with safety in mind. We will always lead with the science, and so right now conditions are at a low risk. It's allowing us to make this decision. We still were one of the most conservative districts in the country, one of the last to make these decisions. And we will also respond very quickly. We were one of the first to respond very quickly on universal masking. We will do that again if the metrics merit so, and it'll always be in consultation with our healthcare experts.
Thanks. And yeah, I'll just finish maybe on a similar note. I see, Namrata Batra on Facebook said, what are the parameters we're looking for when we're making an informed decision about optional masking? So those of you who've been following all along, you guys know we're all about the data and the outcomes and the metrics. And that's, right up top, I started with saying, I don't think the U.S. has done that well from a COVID perspective, not because we haven't tried, not because I don't think there haven't been amazing folks here and everywhere responding, but the fact that we have had so many more people die from COVID is disturbing to me. I feel strongly, and I know you've seen from our political leadership, from the mayor on down here in Chicago, that we remain absolutely committed to doing what we need to do to protect Chicago. And that means from the direct effects of COVID as well as the indirect effects of COVID. And at the time, the reason we've set these metrics up, why we share the dashboard with you every day, why we're committed to this, is I believe so strongly in being honest about risk. And if we need, we start seeing cases back on the increase.
Yes.
We start seeing a variant that looks concerning. We start seeing folks coming to the emergency department. We are not going to wait if we need to act. CPS in particular, extra committed to doing way more, even than the CDC requires or recommends, because we want to stay safe. The city, we're doing a lot more in other high-risk settings than is necessary, and we're doubling down on the lessons from COVID to say, how do we make sure as a city we're prepared, not just for the COVID surge, but for whatever's coming next. And I think the centrality for me of education and in-person high-quality education, and I'm super committed to making sure that CPS continues to provide the amazing education for kids in Chicago that it does. And so, we're going to keep working, not just on COVID, but, we keep saying we can't wait until we can talk about other things, right? The social, emotional, and the mental health pieces, and what does it mean to sort of think about public health sort of in schools more broadly. And I think there's a lot of opportunities, right? Like, as there's been more nurses and more social workers, and how do we think about health as part of CPS, while recognizing, your goal is to make sure the kids are healthy so that they can be educated well.
Absolutely.
Our goal is to keep them healthy so, everyone can go from there. So thank you again for being on. Thank you for everybody's really thoughtful questions. We will be back on Thursday. Today's Tuesday, yes. We will be back on Thursday, and we'll talk some more actually about long COVID. I think that's a good thing to talk a little bit about the science and some of what we're setting up here. But in the meantime, the news continues to be good. Please be kind to each other. People are feeling nervous right now, and the data does continue to look good. Know that we're watching. We are not letting up on this, but we are in a good place. So
thank you, Dr. White.
Thank you. We'll see you on Thursday.